Hello and welcome to the weekly blog. My name is Dr. David Hutchings. As always, these are being sponsored by SpectrumMed. Real quickly, we are all geared up and ready for the April 7th lecture for the NARA conference. We'll be featured a two-part series on the impacts of dementia and Alzheimer's patients have had with the COVID pandemic. So we'll be talking about the COVID fog, we'll be talking about the medications, we'll be talking about the social isolation, kind of the whole package there in terms of how it impacted the patients, and then we're going to go into treatment on the second series, which is in June. So we're really excited about that. I did want to talk briefly this morning about something that we have literally changed the entire way we do the second day of our course, as well as the entire lab sessions. So we have traditionally kind of, or at least when it comes to my portion of it, I have not been as vigilant in teaching the ETS mode. And so once I started to really get comfortable with this, I realized how cool it really was. Because once we teach the NMES portion, we teach the SCMG portion, then we put it into this therapeutic, functional type setting where, and again, we've designed our entire second day of the course basically designed to follow the same pattern, and also looking at the lab sessions. So once we have the SEMG readings, we can then set that target in the ETS mode. So if we know a normative data is 342 microvolts, we can set that at 400. And then we know the patient's motor point, and let's just say for me, my motor point is 18 milliamps. What I would do then is set it at 18. So if I don't swallow and hit that 400 microvolt target, I don't get the stimulation. But also what's neat is you can adjust the work time and the relaxation time. So if you pull the relaxation time down to zero and your work time up to 4 seconds, immediately when I swallow, I'm immediately getting stimulation. So we no longer really have to wait for that 12 seconds to come down and the 4 seconds to contraction time to hit to get the stimulation at the same time as the swallow. So what's neat is the ETS mode is kind of bringing everything into a functional treatment session where we know our motor point. We know that when we do the NMES, we know where we want to go in terms of our target, and we know the baseline for the SCMG readings, and they have to reach that target, and if they don't, obviously they don't get the stimulation. So it's a really neat mode, and really excited to continue to teach that, but also bring that to the Medline folks beginning in June. So looking forward to that. So we will see you all again next week. Thanks. Bye.